to ride with the community paramedic program was another side of EMS that a lot of people are not familiar with. It's a relatively new innovation that serves to bridge the gap between emergency medical services, the emergency room, and primary care that may or may not be available.
Over 4 years ago, we got the idea to bring medical students and family medicine residents into the rotation with EMS. We've had medical rotations with emergency medicine residents for several decades, but those 4 years ago, we thought it would be a good idea to bring in medical students and family medicine residents, a population of people who typically don't get a lot of time with emergency medical services or pre-hospital medicine at all.
I found that we were able to do a lot of procedures and a lot of patient interaction on the ambulance that I normally wouldn't get to do until I was a fourth-year medical student or even a medical resident.
Thoroughly enjoyed that rotation because I got to see what it was like kind of outside of the office setting to treat people. Riding around with the paramedics was great in the sense that it got us out of the office so that we can see how people live at home, how that affects their care and their health, and then how chaotic it can be sometimes on the scene where it's much more controlled in our office. So I've thoroughly appreciated that. I also got to do a lot of hands-on stuff that we don't really get to do when we're in the hospitals, so I really enjoyed that.
The benefits of having physicians ride with us on the ambulances, it helps both of us out. We all have different roles and responsibilities in this field. Despite that, we are all links in the same chain. Having them ride with us allows us the opportunity to listen to their line of questioning, see what's important to them, what kind of pertinent details that they're looking for. And then also, as far as helping them out, it allows us the opportunity to show them what we do on our side. They get the opportunity to help us out as well as us show them different tricks of the trade. We've had several physicians ride with me that were just amazed that we were able to do things on scene that they had no idea that we could do. They thought that we just load the patient up and go to the hospital. So for us to show them what we can do out in the field as far as treating patients, and in many scenarios we don't even have to transport the patient. We can treat them and then release them on scene with the physician's orders.
I always knew that they were highly professional, the EMT service, the EMS service as a whole. But being actually to be there with them and seeing how they operate really kind of helped solidify my respect for them, as well as just a deeper understanding of how they operate as a whole.
There are multiple ways to organize the rotation. There's a traditional EMS rotation where the student or resident goes out with paramedics in an ambulance on traditional 911 calls. We also have other ways to organize it by having the student or resident go out with our community paramedic program, and this has a lot of relevance to the family medicine residents. There's also a QA, quality assurance, or CQI, continuous quality improvement rotation, that can be integrated with a medical director rotation where the student or resident learns how to be a medical director of an EMS service.
I believe there will be a time in the future that I will have to either receive patients from EMS team or have to, if I'm in a more of a rural setting, have to call upon them to help me out, and knowing what those capabilities are and even limitations to a certain degree will kind of help me get better as a physician.
As far as the medical students go, this will be a relatively unique experience because there are no other emergency medicine and particularly no EMS or pre-hospital rotations that they would do as students.
When I was in a rotation with EMS, I definitely feel I became more confident as a physician.
I'd say take the opportunity to do an EMS rotation while you can. It's really rewarding, and it's definitely going to help you in your future rotations and your future career.